Hello, I'm Dr. Vivian Asamoah. I am a board certified gastroenterologist and functional medicine provider in the Katy, Houston area. I wanted to take a little bit of time to talk about the COVID-19 vaccine and indications for our patients with inflammatory bowel disease. Our practice is one that helps and treats a lot of patients with mild, moderate, and severe Crohn's disease and ulcerative colitis, as well as indeterminate inflammatory bowel disease, and our patients have been shooting us a lot of questions about the COVID-19 vaccine. So I'm going to try and make this as concise as possible. I have separated it into four major topics. The first, talking about the vaccine itself. The second, who is eligible and when. The third topic will just be about the day of the vaccination. And finally, what to expect post-vaccination. This month, actually in January, as part of our educational email series, we focused a lot on autoimmunity and nutrition. And IBD is an autoimmune disease. And, there's a lot of data that has come out right now about the importance of avoiding pro-inflammatory foods like dairy and gluten and nightshades and sugar in patients who have autoimmune disease, as we know that this unfortunately promotes the inflammation in the body. So before we even get into the COVID vaccination, I really want to highlight the importance of eating a well-balanced, healthy diet, diverse fruits and lots of fresh fruits and vegetables, minimizing red meat if you can, making sure you're taking vitamin D at optimal levels, vitamin C at optimal levels, magnesium if needed, for all patients, and omega fish oil, a very good anti-inflammatory agent for all our patients with inflammatory bowel disease who very often have malabsorption issues, right? So if you haven't joined the email series on autoimmunity and nutrition, please sign up. I'm sure there are Facebook posts from the week prior where you can sign up and start getting a little bit more information. Now let's dig into COVID-19. So it is, as we know, it has been approved for emergency use. Emergency use right now because we don't have long-term studies talking about the long-term side effects of this vaccination. But in terms of the safety and effectiveness of the vaccine, there have been rigorous studies, including 30 to 50,000 patients, which is more than generally we see for average vaccine studies. It is now approved through two companies, Pfizer and Moderna. There's a third company in place, that's the Oxford through AstraZeneca, which will be coming out soon. So far, these are vaccines that work through mRNA technology. And so they actually identify one of the little spikes, the mRNA codes for the spikes on the coronavirus. And this is what appears as the antigen to the body, and then the body makes antibodies that fights against it. So this is not a live vaccine, and our patients with IBD know that we do not advise live vaccinations for inflammatory bowel disease patients on biologics especially. So this is not a live vaccine. The vaccine is any patient over the age of 16 who falls under the criteria. So we're now moving into the WHO of eligibility can get the vaccination. So 16 and up. And the way the federal government kind of launched this was initially highest risk healthcare workers, and then patients at long-term acute facilities, nursing homes and things. And third, essential workers. And then finally, it will be open up in, I think, in a few months and maybe sooner to patients with chronic comorbidities, which includes inflammatory bowel disease. And we are seeing a lot of patients with IBD already who are essential health, who are healthcare workers, like my physician friends who have IBD, nurses who have IBD, who've already received the vaccination and had no major issue with it. So that's good. So we don't have a lot of data on pregnant patients. There's no data actually on patients who are pregnant, breastfeeding, or going through any kind of fertility treatment. So I usually defer to your obstetrician and say, please have that very important conversation with them. Again, there's a lot of data that we do not have, so they will be limited. And then secondly, none of these studies in terms of testing for the COVID vaccine included patients with inflammatory bowel disease. And I think it's only we're going to get more information post-vaccination as to what does indeed happen. So let's move on to the day of the procedure. So you do not need to stop your biologics. So people who are taking any form of treatment for IBD, whether it's steroids, whether it's 5-ASAs like Lialda, Pentasa, Aprizo, immunomodulators like azathioprine, methotrexate, 6-MP, or biologics like Remicade, Entyvio, Stelara, Simponi, do not need to stop their medication. All these patients are eligible for the vaccine, okay? Anyone who's had surgery, a J pouch, a total colectomy, surgical resection with Crohn's disease or ulcerative colitis, all eligible to get the vaccine. Our patients with IBD who had COVID-19 over the last year or so, also eligible to get the vaccine. Patients we ask to hold off are patients who were recently diagnosed that still need to go through their 14-day quarantine. We actually advise that you defer for about 90 days to get the vaccine. We also do not advise you to stack vaccines, like get the pneumonia today and then get the COVID the next day, or get the flu. Try and take them apart from each other so we know when there's a side effect to one, okay? So the day of the vaccine, take your medications as usual. Make sure you provide all the information to the healthcare provider who is administering the vaccine. Let them know about any allergies you may have or any reactions that you actually have to your biologics. Some patients get a lot of rigors, some fevers, some headaches when they're getting their biologics and need steroids or Benadryl. Just let them know this does not preclude you from getting the vaccine, but it helps provide some information as to how they should monitor you post-vaccine. And I'm going back to the question of food allergies because this has come up twice in portal messages. Patients say, they have food allergies, seasonal allergies, allergies to egg. We haven't noticed that any of those allergies impact the COVID-19 vaccine. The only thing that I've read about is polyethylene glycol, because I think there's a component of that in the vaccine itself. And so polyethylene glycol is quite commonly used for PrEP. That's the active ingredient and what our patients use when they're prepping for a colonoscopy. And I know all my patients with IBD have had multiple colonoscopies. So if you hadn't had any reaction to that, that should not be an issue. So in terms of the day of the vaccine, post-vaccination, we're moving on to post-vaccination now. With the first vaccine, you may, just feel a little bit of soreness at the site. And then with the booster, which is at 21 days for Pfizer and about 28 days, I believe, for Moderna, 24 to 36 hours post booster, a lot of patients experience flu-like symptoms. I know I did. So myalgia, sort of muscle aches, headaches, generalized weakness, extreme fatigue. Some people experience loose stools. So we generally, this is expected and typical. It's actually believed to be secondary to a strong immune response reacting and making antibodies against the COVID-19 protein. And so if this does happen, we generally recommend just rest, hydration, make sure you're eating healthy that day. Generally, I would advise patients to take the day off, especially if you don't know what kind of response you will have, okay? And then the question is, are you protected, So we know that after the first vaccine, there's at least 50% efficacy in protection. And after the booster shot, about 90% after about 10 days of that the booster shot. And we also know that this vaccine prevents against a severe COVID-19 infection like pneumonia, the neurological impacts, you needing to be in the ICU, death. It prevents against severe COVID-19 infection for up to a year. The caveat here is that you can still get COVID-19, but you may get a very mild attenuated form of it. But you could still transmit it to someone who has not received the vaccine. We do believe that once you've had the vaccine, risk of transmission is low, but it's still there. So bottom line here is, even though you get the vaccination, we don't know how our patients who are severely immunosuppressed from inflammatory bowel disease medications like steroids, chronic use of steroids, high dose steroids, and also on combination therapy like infliximab, Remicade, and another immunomodulator. These patients we feel are immunosuppressed. We don't know if they're going to mount a response that is protective enough against the virus. And that is still a big question mark for us. And I think that we will probably have to check titers at some point, but the data is not clear as to exactly when and the information we get from the titers. I'm sure there'll be more information to follow. But another big take-home message is that you still have to stay protected. You still have to wear your mask, social distance, wash your hands regularly, and avoid sort of crowds and groups, because you could still transmit this. You can still catch it, and you can still transmit this to someone who has not yet received the vaccination or has chosen not to get the vaccination, and they may have more severe infection. Yes, we hope the risk of transmission is low, but we're not sure. So that's all the information I have for now. If you have inflammatory bowel disease, your next step to get vaccinated. Take the day off after that booster vaccine. Reconnect with me or your other gastroenterologist or PCP, and let them know if you have any side effects at all. We are starting a registry. We are joining onto a registry, so we'd really like to hear about adverse reactions that we can follow for our patients with IBD. And actually document it so we can track and really understand what's going on in terms of long-term side effects. If you have any additional questions, feel free to email me, send me a message through the portal. I will try and respond as quickly as possible. And as I learn more about the vaccine and how it relates to our patients, to you, if you have inflammatory bowel disease, I will definitely post more information and also do a few more videos to keep you all updated. Have a wonderful day and get vaccinated. Bye-bye.